Hi, I'm John Tumolo. I'm a clinical cardiologist working in Southbridge. I mostly work here at Harrington Hospital and also work at UMass Medical Center, where I do procedures and also help with some of the education of the fellows and residents there. I'm looking forward to this opportunity to chat with you today, period. I've been at Harrington in the Southbridge area for over 25 years. Just a little bit about myself, I do a fair amount of clinical work, seeing patients in consultation, stress testing, cardiac imaging, which would include echocardiography, stress echo imaging, and nuclear imaging techniques. In addition, I've been very active with the cardiac rehab program that I've been heading up since Dr. Van Voren left the program. I've been working with the intensive care unit and working very closely with the hospitalists and the new program that we have with UMass called the EICU program. In addition to the clinical services, I also do cardiac pacing. And one of the exciting things that has developed in that area is the advent of a new system that's now MRI capable. This allows a pacemaker to be placed and to allow you to have an MRI scan. In the past, this would not be permissible because of safety considerations. With some of the new developments and the changes of the leads and the pulse generator protection, we can now place these type of pacemakers, and then this will allow MRIs in later years of your life. They work the same, they're monitored the same, they just have added protection in place. So we're very excited about this new capability that we're bringing to Harrington Hospital. One area that I want to chat with you about today is some of the early symptoms and signs of coronary disease, and many times these are underrepresented or under-considered. It's important not to neglect these. We might all think about the typical symptoms of chest pain, chest pressure, shortness of breath, crushing feeling in your chest, sometimes in your right arm, sometimes in the left, maybe both, may radiate up to your neck and throat. These are the typical ones. Come in right away. Don't delay on this. In addition, some people may have more of a muted or gentler presentation. More common in women than in men. There may be tiredness, there may be a shortness of breath, or fatigue, or an unusual amount of fatigue lasting for a while. If it's more than usual, come in right away. Don't delay. The most important thing is let someone take a look at you. We don't mind if it's a false alarm, but we certainly don't want to miss something that's very important. One thing that you may want to talk with your doctor about is how do you look in regards to your cardiovascular risk. How's your blood sugar? Now look at your weight, your body mass index, which is important. How's your lipid analysis? And these are all important factors that play into the potential risk for coronary and vascular disease. Smoking's very important to deal with. It's the most important risk factor that you might have that you can modify. There aren't too many risk factors that you have control of. This is one. This is probably the most important. In the top 5, this is 1 through 4. So I can't emphasize the importance of smoking. So talk with your doctor about this problem. And in addition, you may want to look at your lipid scorecard. How is your total cholesterol, your LDL, and your HDL? All of these are used in risk factor calculation and risk assessment. You may be a candidate for lifestyle modification, which may include exercise and dieting. If there are more significant findings, you may have to be considered for some of the medications that we have, such as statins like lovastatin, pravastatin, Crestor, Lipitor, and there's several others. In addition, for those people who can't take statins, there are other medications available. So look at your scorecard and analyze your risk. One important thing is that age should not be a limitation. When we look at risk stratifying and the benefit of different medications, patients who are older gain a greater benefit than even if you're younger. So don't delay. If you're older and you don't think it will make a difference, it may have the greatest benefit for you. Thank you for allowing me to have a few minutes of your time.